Hello and welcome to the Thursday, April 16th edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith and I am here with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, we have a new COVID-19 positive patient in our hospital today. What is the situation?
So thanks, Tracy. At this point in time, we have 3 COVID positive patients in our hospital. Unfortunately, 2 are in the ICU in serious condition. So our thoughts and prayers are with these individuals who are getting the best medical care from a great medical team of nurses and respiratory technologists and physicians. So yes, it's disappointing, but not unexpected, and we're well prepared for that. Also, unfortunately, we've also had 8 new cases of COVID-19 that have been tested positive through our assessment center and through our inpatient unit. Again, that is discouraging, but a lot of those 8 patients identified was due to a backlog over the weekend of results getting back to us. So I still feel that we're maintaining a curve. The curve is still fairly flat. We're still in a good position here at Thunder Bay and the region. Certainly, and many of the new contacts can be traced back to one area of significant spread that the public health is working with. So again, disappointing, but certainly not overwhelming. We still have lots of capacity in the ICU. So again, patients coming for other sort of concerns will be well taken care of. We also have 6 patients in our new COVID-19 unit, and certainly those include both the positive as well as highly suspicious cases waiting for results to come back. So those are again disappointing, but not unexpected. But there is, a glimpse of good news in the sense that after speaking with many individuals at the Ministry of Health, as well as Ontario Health North, as well as the public health, there is a commitment for an increased turnaround time for our sort of test results, and I'm confident that we can deliver, and hopefully within 72 hours and not the 5 or 6 days it's been in the past. So I think our partners are working very hard because they realize that the North certainly needs special attention because of the transportation and other sort of challenges we have here in the North. So I am positive that everybody try to work together now and trying to help the community in Northwestern Ontario. And I'm still haven't given up on in-house testing. I think we're waiting to hear some positive news regarding the some in-house testing. In fact, as of this morning, we have the ability to probably do about 60 in-house testing at our lab ourselves at Thunder Regional Hospital. That's not a lot, but we can prioritize certain individuals that we need a test result back in 2 or 3 hours. So as of this morning, we've had a number of kits delivered that we can do some in-house testing for priority cases. So from yesterday to today, things have turned around somewhat, and we're going the right direction. We're not there yet. I hope it can be sustainable, but with the supply issues throughout the world, it may be difficult, but everybody's working together to give the Thunder Bay Hospital as well as the region some needed help.
And how long do you expect those 60 test kits to last for priority testing?
Well, certainly if we do more than 60 a day at our assessment center and inpatients, so they could be gone in a day. But if we're selective with good medical directives, I'm hoping they can last up to 5 or 6 days in high priority cases, which we're developing the criteria as you speak.
So that is good news that we have some capacity here. You're continuing to work for expanded capacity, and that's going to be especially important as testing criteria changes again. What is happening in that area?
Yes, the Ontario Public Health has released new guidelines for testing and screening, and we have not been as timely initiating those guidelines because of our concern with turnaround time. But we do know we have a duty to follow regarding what are the best recommendations from Ontario Public Health. So within the next day or two, we're going to increase or decrease our screening criteria to just one symptom now. Prior to this, it was two symptoms. Now, anybody who are symptomatic, still to be symptomatic, with a new onset cough, with a fever, with shortness of breath, with fatigue, with a runny nose, with gastrointestinal symptom, they just need one of those symptoms, and they would be considered, you'd phone public health, and they would be considered for doing a swab or an assessment on them. That will bring up some challenges with our hospital too, in the sense that because the criteria are loosened, and they were loosened for a good reason. They're loosened to make sure staff isn't bringing in, COVID-19 to the hospital, because we know about 30 to 40%, we hear different sort of values all the time, that there are a lot of asymptomatic carriers out there. So we need to protect other staff in the hospital. We need to protect our patients in the hospital. So the guidelines are based on good evidence, but our concern there, if a lot of our employees screen positive, we could have a difficulty in staffing our hospital. But we're confident now with the turnaround time shortened that we can cope with being off work for 2 or 3 days, not 5 or 6 days.
Okay, that is a big development, and you said that will roll out in the next couple of days.
Yes.
Okay, so people can expect to see that change at hospital entrances when they're screened.
Yes.
Okay, there's also been a development regarding personal protective equipment for staff, or PPE. What is the change regarding the way cloth masks will be distributed? Again,
the cloth masks are not a perfect science, and I think all health officials will be the first to recognize that. The cloth masks here at Thunder Regional Hospital are being made locally, and they're also being inserted a filter in our cloth masks. So we have confidence they are certainly will protect from our staff spreading the virus to other staff, and also spreading the virus to patients. Again, it's not to be used when doing direct patient care, because it's not a good protection from getting the virus from a patient, or getting a virus from somebody else. So we still have to maintain our physical distancing as much as possible, but in a hospital environment, it's almost impossible to maintain that 2-meter physical distancing, especially on stairs and hallways. So it's another step that we are going to use in the hospital to heighten the safety for both patients and staff. It's going to take a bit to roll out. We have had an ongoing order, and we're guaranteed the supply, but it's got to be staged. Everybody won't get a mask, on day one, but over the next week, we think we'll have all staff who have the ability to or need to wear the cloth mask when they can't maintain their 2-meter distancing. But I think we're also considering making this mandatory. We're bringing this back to our IMS structure because of the asymptomatic patients and staff that come to the hospital. We may have to consider making this mandatory so our staff are not spreading it to other staff and to patients. We haven't made a final decision on that, but you have further news to come over the next several days with that.
Okay, we'll look forward to that news. Now, I want to go back to a few days ago, Dr. Kennedy, when you mentioned a post-pandemic recovery plan. What can you tell us about activity in that area?
Thanks, Tracie. You've heard me discuss several other times that I'm concerned about the non-COVID patients not getting their medical attention, the delay in surgery, the individuals waiting at home who have other chronic medical illnesses who aren't getting the attention they need, and this can't go on. COVID-19's here for quite some time. What we're trying to do is sort of stem the peak of it, okay, and lessen the curve so that we can cope with it from a healthcare sort of matter. But we can't go on for months and months without having the hospital open for business. So we see the need, the community has a need to begin to normalize sort of procedures that their healthcare needs can be taken place. They can get their appropriate diagnostic tools, they can get their proper MRIs and their CT scans, their angiograms. We need to begin that process. We got a plan for that process. So we put a large team together. Jessica Lugozo is working in that team right now. That would be professionals, it would be nurses, it would be physicians, it would be administrators, it would be planners, and that team is reporting through our planning structure to our lead structure at the IMS to actually be prepared. We're not saying we're loosening the guidelines for physical distancing and we're going to jump right back into business, but we need to have a plan to how we determine what is the priorities that we move back into business. And they're putting a team together of skilled individuals. They'll bring back sort of presentations to us. We don't even have any timelines in date, but we need to be prepared to get back to normal business so the health care of our community is taken care of at this hospital.
So we'll check in with you regularly on that. That's really important work for the community in order to really reduce or minimize the health decline of people who are waiting in the community. So wonderful work.
Absolutely. I've always said, Tracie, that we're going to have more people unfortunately die of non-COVID than COVID disease in this community. But I encourage everybody, we're not over the threat yet. We're doing a remarkable job. The teams are working well together, but we need to make sure we have the community support to make sure they continue that physical distancing, continue to stay at home, because again, I'm confident we can be a community that COVID-19 will have a minimal impact on certainly death and morbidity.
Okay, so keep up the good work, everyone. Thank you, and we'll see you again tomorrow.